You're listening to Health Professional Radio. My name is Wayne Bucklar, and today we're joined by Andrew Tucker. Now, Andrew's actually been with us before on the air. He's the Chief Executive Officer of IT on Cloud, and today we're going to talk about ransomware. Now, it sounds like something that comes out of a movie on Hollywood, but let's find out. Andrew, welcome to the show.
Thank you, Wayne. Great to be back on the show.
Now, I think a lot of people would have heard of ransomware, but it's the same lot of people don't understand what it is. Can you explain it for us?
Sure. It's fundamentally a bit of software that underlies a link that is emailed to you. Now, what happens is you get an email that looks very authentic, and it says, please click here to either get your updated statement, or there's something from the post office. And you happily click on that little link, and what it does is the minute you do that, it downloads a little virus/application onto your machine, and then it starts to encrypt all your data or on your machine or on your servers at the office to a point where it actually locks everything up, and you get a little message on your screen saying, please contact this number and send this money to get your data back. Unfortunately, that's not always the case, though, so one needs to take a bit more precaution about how not to be caught in that trap.
Now, for most ordinary businesses, that's going to be pretty catastrophic, but in the health sector,
Yes.
That's going to be cataclysmic.
Correct.
So, two questions for you. How do you avoid it, and how do you fix it?
Yes, I know, because it often becomes a breach of privacy as well. So in the health sector, look, there are a number of ways, and one starts off with user education. So really to become smart, understanding what to look for when you get emails, and especially in accounting departments as well. Because that's where they sort of target is to say, please click on your statement or get your invoice, and you think it's authentic because it comes from your utilities bill. Always look at the email address. So generally, if there's anything with a link that comes into you to please click this to get something, that should be your first trigger of a warning saying, okay, well, let me have a look at the email. So right-click on the email that's from the sender, and generally you'll get to see that it normally is a garbage email address that's up there. So it has nothing to do with the sender, so it doesn't have their domain. Now also be careful, because now they're getting a little bit smarter, because they also look at the fact that they will then slightly change spelling in the domain. So at first glance it looks authentic. So make sure the spelling is correct in the domain. So that's the one thing there to start off with is, and generally speaking, you can sort of inhibit that initial encryption by just doing that. The second thing is to make sure that you're running backups. Now, with the health industry, obviously you don't want and you can't run backups that are just every day. You should be running things called snapshots, so that it's taking every hour, every half an hour, depending on the criticality of your data. Because you as a business need to look at it and say, well, how much data can I lose to continue to be able to do my business? And what I mean by that is if it strikes at 9 o'clock and your last backup was done at, say, 8:50, then you've just lost 10 minutes worth of data. So again, that becomes a strategy around the business and how you do your backups. And please check your backups that they are working, because one tends to run these backups over and over again without even doing a fire test. A fire test means that you need to decide on when you're going to do a restore test to make sure that the data is always retrievable. And I'll explain why that's so important in a moment. The next thing is also to ensure that your antivirus software and your spam filters are up to date and continuously being maintained. And look, spamware is quite tricky because it's generally speaking, it's an email, and with a click on it, the click through to download the actual virus, which means the antivirus software itself is sort of tricked. But there are better software applications coming out specifically to cater for this type of intrusion into your system. So These are the sort of three things one needs to maintain in your environment. Now, you can either do that on premise, if you're in a hosting provider or a cloud provider, they generally do supply that. But make sure if you've got an infrastructure as a service offering, generally that responsibility relies on you. And if you've also got, for example, OneDrive or any of those storage facilities, again, the responsibility relies on you to maintain your local antivirus because they don't offer that. Whereas a full hosted environment in a private cloud, they will manage everything for you.
Now, Andrew, doctors and nurses and clinicians generally are probably not renowned for being very good with computer systems. Is this the sort of problem that affects big organisations and hospitals as well as general practitioners and your local dentist?
Look, again, it all depends on who the ransomware company / person is. So some of them want to be recognized for something big and exciting, so they'll target something large. But generally speaking, it's just someone that wants to raise some cash quickly and sends it out as a spam to as many people as possible. So unfortunately, it doesn't. It has no specific target. It looks for any of the users that they can get that information out of, and they know that if they hit the health industry, one has to respond and get that data back. So they do know that that target is a soft target and quite a popular target in that saying that.
And even in the days of credit card theft and identity theft, hospitals and health providers make such a great target to hack because they have all of the data about people from their date of birth to who their parents were to what they did and who their spouses were and all those questions that you can ask for security. All of that's included in your medical records.
It is, and especially next of kin and their details, as you're right, yes, because obviously if there's an emergency, that's what they tap on. So they get more bang for their buck on the medical fraternity, yes.
And have there been some real attacks in recent times?
There have been, and I think the most public one has been really around the Queensland hospitals and even the UK National Health Service. So there's been a few of them. I do know of some more local ones, but at the moment they're not wanting to be named publicly for obvious reasons because of the breaches. But yeah, there have been some very big public ones that have been attacked, and the damage is quite severe in a sense. So it's not nice, and something one can in a way prevent.
Now, in the interest of full disclosure, Andrew, we should say that IT Online, your business, provides hosted environments. Why is a hosted environment a better option?
Well, as you mentioned earlier on, generally speaking, practitioners or the hospitals, they are about providing care to their clients, and where IT is not their first in mind thing, they need to make sure that they can hand it over to someone that actually has the expertise and the knowledge in delivering these sort of protections. In our environment, because we do that, as I spoke of earlier, snapshotting, we have had some attacks in where some of our clients have clicked on the links. We shut it down. We get an alert almost immediately that this is happening. It gets shut down, and we do a restore. So a maximum downtime for that specific user would be around about between 5 and 20 minutes. So that's sort of the timeline that's in there. But we are spending lots of cash around methods of protecting it, new technology that's protecting it. And again, the way that we do our backup and restore regime is well and truly tested and tried.
Now, if you've got your IT solutions in the cloud,
yes, is
one customer isolated from another, or does an infection spread because you're on the cloud and sharing resources on the cloud with other businesses? Does the infection spread through that provider, or are they isolated from each other?
That's a great question, and quite often asked. So again, it depends on the provider and how they do their setup. So a well-established and well-funded provider will certainly have everything isolated. So would it happen with a transport? No, it wouldn't. But if it hasn't been designed correctly from day one, then you will have the fact that it will then cross-pollinate into all others, because there will be openings and back doors and all those good things that these unscrupulous people look to do.
Mm-hmm.
So yeah, you got to be wise on your choice and how you go about actually doing that.
Andrew, it's been a pleasure having a chat with you today, and I have no doubt that some of our listeners will be thinking, my goodness, I don't know how well protected I am against ransomware, and I don't know if we've got the procedures in place to deal with it if it happens. For those people, how can they get in touch with you?
So we're available on information's on the web under itoncloud.com. Alternatively, I'm always happy to have a chat with them on the phone, and my mobile number is available. It's 0410-814921. Happy to chat about it and even point them in the direction, because our solution might not suit everybody, and I'm more than happy to point them in the right direction.
Andrew, thank you for your time today. It's been a pleasure having a chat with you again.
Welcome, and all the best to all those that are out there.
Thank you. If you've missed my conversation with Andrew Tucker, the good news is on our website at www.hpr.fm, you can access a transcript of the call. You can also access the audio archive on SoundCloud, iTunes, and YouTube, where you can hear the whole interview again. My name is Wayne Bucklar, and you're listening to Health Professional Radio.